Good morning, everyone, to the Hampshire Local Outbreak Engagement Board. Can I start by having apologies for absence, please?
We have apologies from Judy Gillow.
Thank you very much. Have we any declarations of interest with the normal rules applying? Okay, thank you very much. Minutes of the previous meeting. Those have been circulated, and as far as I know, no one's made any comments on them. Are you happy for me to sign those electronically?
Yeah.
If you're not, put your hand up. If you are happy, you don't have to do anything. Good. Okay. Moving on. Item 6 on the agenda. Oh, wait a minute. No, we've got a few other things before then. I can find them. Deputations. I don't think we have any deputations, do we?
We don't, Councillor Manns.
And Chairman's announcements. I've got nothing specific to say, which won't be covered by Simon, but obviously it is very encouraging indeed that we have completed as many vaccinations as we have in the county, and I can tell the Outbreak Management Board that I had my vaccination 2 weeks ago. And I can see one or two other people on the screen have probably had theirs as well, of the being of a certain age. Right, let's move straight on to item 6. Simon, would you give us a outbreak control position report?
Thank you very much, Leader. If with permission, I'll share a presentation of the data. Do let me know if that's visible. Is that on screen now? Fine.
Looks good.
Perfect. As with previous boards, I will do a presentation of the data and the situation, and do a couple of updates on community and surge testing as well, taking you through. But I'll go through a fairly quick pace because we're used to this style, but do ask questions at the end if that's needed. So this is the national picture. Just worth saying, they have changed the scale on the map. So whilst it looks like there's more red on this map, and it did give me a bit of alarm, actually looking at the scaling, we can see that with regard to Hampshire down here, we are in a much better position, and our rate is in the lowest category reported there. So that's really good, with some areas neighbouring slightly higher. So that's Hampshire as a whole, and we've seen that decrease. We do see by ethnicity a little bit of variation. With the rates are coming down in all ethnic groups, but some of them are a little bit higher. So we are doing lots of work, particularly around the communicators and marketing, to ensure that we target and support those groups to take the appropriate action. When we look at the map across South East, you'll remember from previous maps, it was kind of a fairly dark purple colour, and we can see now that actually our rates are coming down really nicely, and across the whole of Hampshire, with Rushmore, which has been higher for some time, is equally coming down. It's coming down more steadily, and it's good to see those rates are falling everywhere. With our R rate for the southeast, and again, I'll just remind you, it's only for the southeast and not a smaller geography, 0.6 to 0.9. So that means that one person now infects less than one person. So that's really good. Right? So that shows the epidemic is reducing. And then if we look across ceremonial Hampshire, again, it gives the rate, the cumulative rate across the whole pandemic. And we can see here that England's rate is at the top, followed by Portsmouth, Southampton, Isle of Wight, and Hampshire. And you can see, just worth illustration, where the new variant is so clear to see on the graph of the Isle of Wight, that where the new variant hit, you can see a rapid rise. And we all everywhere locally experience that rapid rise. And you can see that Hampshire has had a lower cumulative rate, which is really positive in terms of the health of our population. Although I say positive in a very careful way, but in terms of where we are with the pandemic. And then when we look at our cases, we can see the second wave and the peak there of 1,600 cases in a day coming right down. And you can see that it continues to fall, which would be positive. So over the course of the pandemic, we have seen 59,000 cases who tested positive. And again, remembering we had pillar 1 at the beginning, and then pillar 1 and pillar 2, pillar 1 being in hospital. And then across the districts, looking at the rates really carefully, we can see that Rushmore now has come to 146, and it kind of slightly different timescales for the different maps, but you can see variation across the county of Hampshire, again with Rushmore at the top and then Winchester at the bottom. So really good news that we've seen that fall. And when we look at the maps, the graphs across the district, you can see that this kind of illustrated where they fall. Rushmore had that very sharp fall, and what we see is when we've got smaller numbers of cases, which is a very positive place to be, actually the rates, you'll find that they go up and down a little bit more volatile, because small numbers mean that actually we see that change. So we can see our rate for Hampshire 7-day rate is 114, and much lower than England, and now lower than the South East, but fairly comparable. And again, we can see Isle of Wight, Southampton and Portsmouth rates there. So we're in a really good position, and it's great to see all our rates falling steadily. And as I illustrated, Rushmore has fallen really fast. So it did have quite a high peak, but it's come right down again. And then we look at over 60s rates. Again, we can see all the rates are falling. This is particularly impacted if there is an outbreak in a care home. So whilst that's not affecting our community spread, it will affect our numbers. And so we just need to be mindful of that. And to assure the board, my team look at all the rates across all the districts and the county every day. And if there's something that is looking like it's going up or not going down as fast, we look to find the reason. Is there a care home? Is there another setting? And we are getting outbreaks in settings which we are managing carefully with various colleagues as appropriate. And equally, what we might do if there's an outbreak in a setting is do more testing. So therefore, you may pick up some asymptomatic people. And again, that will impact on the rate. But we look at all of that to make sure that the rates continue to fall. And then the age groups, we can see the this graph. So with the darker purple shows the age bands which are more affected. And we know it's people of 20 to 34, and then the older age band. So that's what we've seen previously. So beginning to see that pattern emerge, and you can see it through time here with the different kind of waves come through. Slightly old, but you can see that when you do a point prevalence, you can see the for Hampshire, Basingstoke and Deane had that fall from the weekly change from the 3rd to the previous week of -43, all coming down with a slight, very slight rise from Easter. This is a little bit old, but you can see that comment I made that, with small numbers, you see a slight rise and fall as the pandemic progresses. And again, this data, I checked this morning, it hasn't been updated recently, but you can see the number of people in hospital is coming down. That's really good news. The NHS is still under pressure, but we can see Portsmouth Hospital has come down to 270. Southampton, the rate a little bit slower. And just for reminding the board that this is about people in hospital, not our residents. And we know that Southampton Hospitals has taken a lot of people from other areas of the country and the southwest of England because of its status as a trauma centre and its ability to step up beds. So it's good that it's coming down, and there's factors in there that mean there's some pressure. And looking at ventilator beds, again, you can see that falling a little bit more steadily. So it's not, some areas have come down, but we can see that it is falling, and we can see that the ventilator bed usage is coming down. And just for a reminder that this isn't the normal capacity of ventilator beds. The hospitals have really stood up surge and super surge capacity to manage the number of people requiring that, which has been an amazing role that the NHS has played in this. But it is great that it's now coming down in terms of critical care needs. And then really the final one we pick up is deaths, and sadly over the pandemic in Hampshire, over 2,000 people have died of COVID, and we're seeing that this is the last data point we have, because there's a lag in terms of where the data is recorded and making sure it's recorded in an appropriate way on the death certificate. So in the last reported data, we've had 180 deaths from COVID, and we can see we're still above the 5-year average, but that is beginning to come down, and that's really positive news. Every death is really sad, and it's great that we're beginning to see less of those. And as I've said previously, we'll do a long piece of work after we've seen the kind of the pandemic to see actually the status of these deaths, and are these excess deaths or were they brought forward, so we can look at deaths in a kind of a longer term plan. And this does that summary of where we are with the pandemic. And just finally, it's worth thinking about positivity rates. So we now, bullet 4, positivity is really, does it show if the pandemic's under control? And New Forest has the lowest positivity of 3.9, all coming down really well. And if it's under 5, it shows the epidemic's under control. So with the New Forest, we're beginning to see that being under control. So that's great news. There'll be a variety of factors impacting on that, not least the vaccination programme and the way the population is adhering to the messages, and also if they need to go to work. But I think that shows a really much more positive picture than I was able to present last time, and shows that we are really moving forward and really preparing for easing of lockdown, and doing that very carefully so that these rates don't rise again. Councillor Manns, if I move on to a couple of issues on community testing, would that be okay to carry on?
Yes, by all means.
So community testing for those without symptoms is to launch across Hampshire. We're waiting for government approval, and it will start operating on the 22nd of February, an appointment only scheme. And this is for front facing workers who have to travel for work. So if you're going to having to work in a supermarket or construction sites, or even some of our staff that aren't covered by other programmes, they will be able to have a lateral flow test. So that's the rapid test. These are the proposed sites. We are working very hard, and I'm really grateful for district colleagues, thanks to Councillor Rattigan and his district council colleagues, for really helping us set that up. It's been a partnership approach, and I know at times we're trying to work at very fast pace to get the right staffing in the right venues, taking a little bit of time, but we are there now. We're waiting for that approval, which we hope will launch on Monday, and then you can book it online. It gives a little bit of information there, how that information is taken forward in terms of that programme. So really excited that programme is there, and that really will help us to understand the asymptomatic population and help to break the chain of infections, so that we can further support people to isolate and prevent this pandemic, because we know about a third of the population will have coronavirus without knowing it, which is obviously mean they're able to spread it to other people. So we're really excited that programme starting up, a huge logistical and public health challenge across the county. And as I say, I'm grateful for everyone who's been taking part in that programme to set that up, and I look forward to that programme setting up. As the government has rolled this out, they've also rolled out testing for particular settings. So as we're developing our bid, we have adapted it and amended it. So when we first started, primary schools weren't included in the national programme. They are now. So all primary school teachers have kits to take home. Equally, companies of 50 or more people can also sign up to have lateral flow tests. So we are adapting our programme in line with what's coming out of the government, and we may find after a few weeks we want to adapt and change this programme to make sure it continues to meet the needs of the Hampshire population, in line with the way the government's developing that and the government funding for this programme. So that's a really exciting programme. Finally, if I can talk about surge testing, so there's been a lot of news around the single case of the South African variant in the Bramley area of Basingstoke. I'm sure Councillor Rattigan is very familiar with what's going on there. The risk is very low from this one case, and that's helped by the fact we're in these national restrictions, and there's no evidence that this variant causes more severe illness. But to enable the government and public health experts to understand how this variant is spreading, we are undertaking surge testing. I use that word carefully because it's slightly different from what I've just talked about in community testing. It's likely to start tomorrow with door-to-door testing of that population. We're working really hard and very fast to get everything lined up so that the programme can roll out for about 3,000 to 4,000 people in that area, with the identified postcodes on our website, with a public health lead, a welfare lead, a logistics lead, with the tests due to arrive today, and with walking routes being designed. And we're taking that forward in line with our partners in Public Health England and the District Council to take that forward. So great work across all sectors to take that forward as we support our understanding of this virus. Councillor Manns, I'll stop sharing there, and as always, very happy to take questions or comments.
Thank you very much, Simon. Questions, Ken?
I'm grateful for that, Chair, and to you, Simon, for the information you've given us. I just want to express my thanks to the surge testing team, who have limited the testing to 4,000, which is the area of Bramley itself, which means that the normal 10,000 has been reduced. It has meant that it's not, the testing is not spread out into Basingstoke itself or some of the suburbs of Basingstoke, and it has meant that it's a much more contained and understandable population that is having the surge testing. It means that it shows the adaptability within national testing procedures to take account of localism, and I'm very grateful for that. I have another couple of questions for you, Simon, if I may, with your indulgence, Chair. Will we see a significant fall in infection rates because this is half term? Is that your view? Or how will you manage that if the figures come down and then go back up again? How will you manage that piece of comms? And finally, the piece on ventilators. Obviously, none of us are health professionals, but is it that people are staying on ventilators longer so as their recovery is better? Just a couple of questions on that.
Thanks so much, Councillor Rattigan. So the surge testing, you're absolutely right. When we looked at this case, we did a forensic examination of this person. I'm very careful. I won't share details of the person because it's patient information. But when we understood the movements and how this case had lived, we were very clear that actually a smaller surge testing cohort was appropriate, and we proposed that to government, and they accepted that was the right thing to do for our area, in line with public health advice that we looked at. So yeah, thank you. It's great that we could do that and contain that in that way. With regard to half term, we know that, as we've always said, the virus spreads when people connect. So if there are less people connecting, we should see a dip in the number of cases, maybe small because the number of people at school is less than normal, and they should be able to social distance better, although it's really challenging, and I'm sure colleagues who are in the teaching profession are not saying it's easy, but we may see that benefit, and then, as you're right, we may see a rise after that. With regard to ventilators, what we're seeing is that the pre-ventilator treatment has got better. So the dexamethasone and the other drug that sits in my mind has worked well on those patients. So some people are staying a long time on ventilators and then coming off, and other people are needing for less amount of time, but we know that I think the average time on a ventilator is about 14 days. That's a significant amount of time that we need to kind of reduce, but the new medicines are really helping to bring that down, so people need less time on a ventilator, but certainly really important we think about that, and then think about the impact that may have on someone's life in the long term. Being in ITU, we need to really think about that kind of post-COVID treatment issues.
Thank you, Simon. That was very appreciative. Thank you for that.
Before I ask Patricia to ask a question, I'd just like to make a comment on the surge and community testing. Certainly the surge testing, I think this is a very good pilot, if you like, that we are learning how to do it. And it'll be very useful if we have to do it again, because we will have the experience with a relatively small village if we should have such a problem in the future with some of the variants of the virus. So I regard what's happening in Bramley as very useful for the county, because it will get us to test the processes we've got on a relatively small scale that can then be upgraded if we have to do it again in a bigger way. So that's good. And to a lesser extent, I think the community testing is useful as well, because it's testing our ability to work at different levels with the districts and ourselves together effectively to ensure that we understand each other's problems, and by slowly rolling it out, which is what we've done, we should, I think, have the best opportunity of actually providing good quality community testing alongside the other methods that the government are using, such as certain sites of a certain size where the testing can be done separately from what we do. And I think the only other point I'd make is that obviously the more that is done in that way, in different ways, there is a need for coordination, so we know exactly. Otherwise, we'll end up with people having a number of tests from different people if we're not careful. But anyway, Patricia.
Thank you, Keith. A couple of questions, two questions to Simon, really. I was delighted to learn that the primary school teachers now have the LFT, the lateral flow test. But is there a timescale coming up when we might be able to extend that to our early years providers, i.e. nursery schools and foster carers? Because those are the people who look after the very young children of key workers, and they are very much at risk, and they are very unhappy about being left behind as they see it. So that's quite one question. Is there a time frame for early years providers and foster carers as well? And of course, we know that we're going to get more children coming through when we come out of this lockdown who will need foster care. So we need to be ready for that. And the other question I was going to ask is, I was delighted to learn that the deaths in Hampshire in care homes are coming down from 208 last week to 180 this week. But is that all care homes in Hampshire, or is that just Hampshire County Council care homes? Thank you.
Thank you very much, Councillor Stallard. So if I can just probably use to clear up the last point. So the death that I presented was deaths across the county, not in care homes. So that's every death, whether that's at home, in hospital, or in a care home. So
yes, I
in the community, so across the patch. So that would include everybody, just for clarity. With regard to the lateral flows for early year settings, you're absolutely right. It's been a huge challenge. I think I kind of mentioned in my presentation that the government also, alongside community testing, has announced other programmes. So as primary school teachers got lateral flow, if the early years setting is connected to a primary school, those staff have lateral flow already, so that's in train. For those that aren't connected, and I know there's some that aren't and some that aren't connected to a school, they will get the they can be part of our community testing programme that starts on Monday. So that's the plan to get that. We're just confirmed, we haven't had confirmation, but that's the plan, confirmed it will start on Monday.
Right, so they will be included. Those who are not attached to a school, i.e. the independent people, will also be included.
Absolutely, for all front-facing workers. Thank you. And I can give you some more details outside, Councillor Stallard, if that's helpful. That
would be extremely helpful, Simon. Thank you very much.
And with regard to foster carers, we're working with Children's Services, and we'll make sure that those who are appropriate for testing. This is for people having to go out to work. So if a foster carer is in fact just kind of in a family, it's a long-term foster placement for a family, we wouldn't be necessarily doing lateral flow on those, but we will be looking at how we undertake those programs going forward. And I know that colleagues are looking at how we make sure that we can get tests rolled out. I think this community testing program for me is the first phase, as Councillor Mann said. We'll be looking at how that changes, and we may be doing this for a number of months, subject to Department of Health finances.
Yeah, if you can understand my concern, I'm just very anxious that we are ready for this influx in care referrals, which we know is going to come.
Absolutely, and we work very closely with Children's Services colleagues to make sure that, as you say, sadly they're not only prepared for the need for the placements, but actually they're as in other words COVID safe placements, so we can make them as safe as possible.
Yeah, thank you very much. Thank you. That'll be helpful.
Any other questions so far for Simon? Okay, Simon, do you want to say a bit about vaccinations and things?
With vaccination data, I know there's been an awful lot of work, and this is an NHS-led programme, and the NHS has done a sterling job of rolling that out, and there have been some teething problems. The data is not yet public, and that's one of the frustrations that we're all contending with, and we are working very closely with colleagues to ensure that the programme rolls out in an effective way. I'd like to assure the board we are doing very well in Hampshire. We have really good uptake in terms of percentages in those first 4 cohorts we're aware of in in health and social care staff, over 80s, over 70s. And we are looking very closely at the data to make sure that any inequalities issues, so anybody who is less likely to take up a vaccine for various reasons, is able to be encouraged and supported, working very closely with our faith sectors, working with community leaders to ensure we can roll that out. So we have seen a huge uptake, and that is really beginning to make a difference on our infection rate in our communities. And I'm grateful for everybody taking part in it. Great news that we can now we know people who've been vaccinated for that first time, and they'll be beginning to call in for their second jab. So I'd just like to assure the board it is going well. We do look at that very carefully, working with the GP practices. We know one of the key aspects that encourages uptake is if the practice phones the person. So if someone isn't coming forward, haven't been invited by letter, the practices will phone them up to encourage them to take the vaccine, and that's going well as well.
Thank you, Simon. I think it's up to us all to try to encourage any members of our community that are reluctant to have the vaccine, to encourage them to do so, regardless of who they are or where they come from, because clearly the higher the percentage of uptake, the better the chances of the pandemic being restricted, and I won't say completely eradicated, because I think that would be a bit too optimistic, but at least we get it down to a level that is manageable. And I'm certain that there are still parts of our community that, for a vast majority of reasons, are reluctant to take up the vaccination. So it's up to us all to try to persuade through the channels we've got that everybody should take up the offer. And indeed, if they're over 70 and you haven't had a vaccination, to actually contact your GP.
Absolutely.
Okay, are there any more questions for Simon? Patricia.
Thank you. Simon, what are we doing to help to educate those ethnic minorities who are fearful of taking the vaccine for all kinds of misinformation that's been put out there?
Really important. Thank you, Councillor Stallard. So we're working with those community leaders. As I said, we've worked with some of the imams and also taking learning from other areas where we know some of the concerns, particularly in those groups, maybe around fertility, and working with experts to provide that information. Providing that information in a culturally appropriate way for them is also happening. And also, as we work with the primary care networks who know their patients, to make sure that they can invite them and approach them in a different, in a way that suits that population. So we're doing an awful lot of that work, both nationally and locally, and learning from colleagues, particularly in places where there's a much higher proportion of the minority communities. With Slough, I've connected with to see what they've done to really increase the uptake. I'd just like to assure the board with regard to looking at the ethnic breakdown, we still do very well. It's not a significant problem in Hampshire. It's one that we are very mindful of, and working with the CCG to ensure that their comms and our comms are appropriately targeted to that group. So it may not have the reach that some of our other great communications have, but actually it'd be more targeted. So we're doing that as well, as you say, to kind of bust the myths, as it were, that there's some people who can't have that. And we're seeing high profile imams, for example, being showing they've had the vaccination to provide that leadership, and that's really great news, and seeing that across the board. So we're working through that, and it's going to be an ongoing piece of work that doesn't stop, with those cohorts. So actually, if someone's over 80 and they haven't had it because they're nervous, or as you say, they've got a myth, they can still come forward. So we're carrying that work, even if the uptake may be a little bit slower in those groups.
Ken.
Can I ask about transient populations, either those who work on the land or our gypsy and traveller population? How are we reaching out to them to make sure that they are covered and they get the vaccine where applicable? They may be as an age problem at the moment, they're not in the right categories, but how will we ensure that they get the vaccination as required?
Thanks very much, Councillor Ashkin. I just need to emphasise this is an NHS programme which we are supporting. So with regard to perhaps those transient communities, we are encouraging them and working with CCG to ensure that they all get registered, because that's the key, registered with a GP practice. Equally, we are looking at kind of mobile models. So actually, do we take the vaccine to some of those communities? So we're looking at that, and we've seen some good work in other parts of the country around the homeless population. So we're looking at all different methods, and with our large vaccination centres, as they really get embedded, so that's the ones we have in Southampton, Portsmouth and Basingstoke, we can use that as a place, as a hub, to then deliver programmes to these communities. And in the county council, we have our Gypsy and Traveller kind of workers, and as I know you will in the districts and boroughs, connecting with those to really support their uptake and make sure that we can work with that. So it's not a fixed model. What this first phase of the programme has shown is we can, at scale, roll it out really quickly. Because if you remember, back in less than 2 months ago, we didn't have a programme started, and now we've done a huge amount of vaccination. So as I said to Councillor Stallard, have we really focus on those populations and nuance the programme as it's embedded? That will help us meet those communities.
Thank you for that, Simon.
Jessica.
Thank you, Councillor Manns. I just wanted to say that from a local authority perspective, we are supporting that contact with hard to reach groups with a view to vaccination. So there is an equalities board with members of the local authority sitting on that board, and we do have staff that work quite closely with Gypsy and Traveller community, as well as I know there is involvement of the third sector to make sure that those groups are hearing from people that they will listen to and trust, and so we're all working together in that respect, and that goes, including the BME community and other hard to reach groups, so people with learning disabilities and so on.
Thank you, Jessica. Any more questions for Simon? Are you happy with the recommendation to note the current data and implications? If you are, you don't need to do anything. If you're not happy, put up your hand. I see no hands, so I take it that we are happy with that recommendation, and we can move on to communications and engagement. And it's over to you, Judith.
Councillor Manns, I'm so sorry. Can we just check about item 7 with Simon and see if there was any actions really quickly?
Yeah, sorry about that. Yes, of course.
Apologies for I think I rolled the actions into the presentations. I've talked about community testing, which is the main thing we're rolling out, and the vaccination programme. So apologies for slightly amending the agenda.
Thank you.
Okay. Judith.
Thank you. Yes. I guess the summary is it's been very busy in comms again for the last month. This report covers the period 6th of January to the 2nd of February. And a lot has happened since the agenda report. I think this is where it's such a fast changing situation. We're constantly playing catch up, and by the time we get to talk about the report at the meeting, we've moved on. But going back to the report, as you'd expect, key campaigns have focused on the rollout of the vaccination programme and reinforcing the stay at home message. In fact, the national lockdown animation was the most successful post last month and reached almost 80,000 people. Overall, we reached almost 700,000 people with 59 social media posts, so working incredibly hard. Other topics covered during the month included the Connect for Communities support to feed vulnerable children during half term. And since the report was published, we've issued further posts on meal vouchers and bespoke animations about half-term activities with child-focused graphics. The changes to the earlier start time for bus passes was publicised, and we've continued to post about mental well-being advice and help for unpaid carers, and continuing signposting for people who may be experiencing domestic abuse. The comms team have dealt with 97 media inquiries in the month, many more than the previous month. And as you'd expect, key areas of inquiry included the mobilisation of the temporary mortuary in Basingstoke and the private care home outbreak also in Basingstoke. Community testing and vaccinations also featured high on the list. There was, as you'd expect, some detailed work on the temporary mortuary with both regional and national responses required, alongside keeping the local community, funeral directors and the bereaved informed, being mindful of the sensitivities involved at all times. As usual, the weekly updates to district councils, MPs, parish councils and so on have continued. Turning to vaccinations, while the programme is being run by the NHS, we have been amplifying that message to ensure people know what's involved, when they're likely to be vaccinated, and very importantly, providing advice on post-vaccination behaviour, that is to say, continuing to follow the rules. Dedicated pages have been created on the County Council website to support the national programme and provide signposting to the NHS Information Hub. There has been targeted messaging on vaccine hesitancy, and I'm disappointed to say that vaccine scams have appeared. And we've done a good deal of messaging around this, which has generated a lot of media interest, which is great because we do need to make people aware of these scams, because they do prey on the vulnerable people, the people who are self-isolating, people who may be shielding the elderly and so on. But even the BBC locally did a lot of news items on that. Throughout, there has been targeted engagement with hard-to-reach audiences, such as the BAME community, as we've heard, and the traveller community. Ken, I believe there's been a targeted video for the traveller community, and also the Nepalese community in the county. Last month, I mentioned we were planning some outdoor media, and I'm pleased to say that posters have been placed in almost 130 strategic points across the county. I haven't seen one, but I haven't been anywhere. Looking at the upcoming priorities on the agenda presentation, which, as I said, is a little bit out of date, but that section is there. You'll see that there were plans in place to deal with surge testing, should it be required, which is just as well, because the programme is due to start tomorrow, and I'm pleased that comms were preparing for that eventuality, hoping we wouldn't have to do it, but ready in case we were. And in addition to continuing to reinforce messaging around the rules and the numerous aspects of the vaccination programme, we're also preparing comms for a possible return to school in March, and a targeted campaign to encourage young men to wear face coverings. We've heard about the bid for the asymptomatic community testing, and the comms preparation for that is well underway, and the booking system is ready to go. And finally, we may still be in February, but we're already looking ahead to the summer, because a lot of events have long lead times, and we're preparing comms again for every eventuality around events. And I'll stop there. Thank you.
Judith, thank you very much for that. Seems a lot is going on with communications at the moment, which is most encouraging.
Incredibly busy, yes.
I notice in the chat there is a comment from Jessica. I don't know whether you want to quickly mention that, Jessica, what you've written.
Yes, of course. Thank you, Councillor Mann. So we are working closely with the NHS again. We have a role as a local authority in terms of managing the eligibility process for informal or unpaid carers. I'm really pleased to say that it's a group that is being targeted as we speak, and it will be through the PCN route, so it will be through those very local GP links and surgeries that those carers will be able to get their vaccinations. clearly we have to make sure that those people access carers allowance, that they are truly carers for individuals. So that's sort of part of the process that we'll be managing carefully through our coronavirus helpline, and with the support of practitioners should they be needed to assess eligibility. But yeah, really welcome, and we've been talking to the voluntary sector carers groups around that, and they really welcome early involvement in that process too. So you should see more on that publicly next week, and as I say, we're preparing a members briefing to come out to you shortly, so you have that information to hand.
Thank you very much, Jessica. Any questions for Judith? Okay, well, thank you all very much. Obviously, very encouraging, the decrease in the number of cases, just beginning to see a reduction in hospital admissions, and hopefully increasingly a reduction in deaths, and of course a vaccination program which is second to none. It's really very, bearing in mind how we started a year ago, I think it's really very encouraging that the vaccination program in Britain has got off to such a good start, with every opportunity of it increasing right into the summer to cover a very high percentage of the total population. Judith. Microphone.
I just wanted to say, and I know we're all aware of the rules and the stay at home and the messaging, and I'm sure that everybody's almost as tired of hearing about it as we are, but we've got to keep on with it, because one of the things about this virus, thank you, I knew it was a V word, sorry, I don't want to say vaccination, the virus, is that whilst it is coming down slowly, hospital admissions are coming down slowly, cases are coming down slowly, but when it gets a hold and takes off, you know, the graphs are much steeper. It goes up very quickly, and so we just cannot afford to let it take again. And anything that we can all do in our communities to keep pushing out that message, it would be great. Thank you.
Thank you, Judith. I think it's a very good comment to end on, that we mustn't reduce our guard because things are moving in the right direction. Okay, well, thank you all very much. Samira, if you like to switch off the broadcast.